Ever wondered what exactly is considered protected health information under the Health Insurance Portability and Accountability Act, or HIPAA? Well, you're in for a treat today as we delve into this complex world. Let's start by understanding the basics. HIPAA PHI, or Protected Health Information, refers to any information about health status, provision of healthcare, or payment for healthcare that can be linked to a specific individual. This is interpreted rather broadly and includes any part of a patient's medical record or payment history. Take, for instance, a scenario where a doctor's office sends out a bill to a patient. This bill, which includes the patient's name, address, and details of the treatment they received, is considered PHI because it can be linked back to the individual. Now, there are 18 types of PHI under HIPAA. These include things like names, geographical data, dates related to the individual, phone numbers, fax numbers, email addresses, social security numbers, medical record numbers, health plan beneficiary numbers, account numbers, certificate or license numbers, vehicle identifiers and serial numbers, device identifiers and serial numbers, web URLs, IP addresses, biometric identifiers, full-face photos and any comparable images, and any other unique identifying number, characteristic, or code. Let's break down a few of these with examples. Names, the most straightforward type of PHI, include not just a patient's full name, but also initials or last name if combined with other identifiable data. For example, if a hospital publishes a list of patients who participated in a health fair, even if it only includes their initials, it is still considered PHI. Next, consider geographical data. This could be anything from a full address to the first 3 digits of a zip code, if it can be used to identify an individual. A practical example of this could be a clinic sending out a mass email about a new branch opening in a specific zip code area, and accidentally including a patient's address in the email. Phone numbers and email addresses are also considered PHI. Consider a scenario where a doctor's office sends a group text or email to patients to inform them about flu shots. If they don't use a BCC function and all the phone numbers or email addresses are visible to recipients, they have just disclosed PHI. It's important to remember that HIPAA PHI isn't just about written or digital data, it also includes spoken information. For instance, if a nurse in a hospital elevator discusses a patient's condition and another person overhears, that's a violation. To summarize, HIPAA PHI encompasses a broad range of information, from names and addresses to phone numbers, email addresses, and even spoken information. It's crucial to handle this information with care to avoid violations and ensure the privacy of patients. It's not just about compliance, it's about trust and maintaining the highest standards of care in healthcare. Remember, the goal is to protect the individual's privacy and confidentiality. Understanding each type of PHI is the first step in ensuring that protection. Stay informed, stay compliant, and most importantly, stay dedicated to the care and respect of your patients.